TB.
What is tuberculosis? Tuberculosis, also historically known as consumption, is an infectious disease caused by a type of bacteria called Mycobacterium tuberculosis that affects the lungs and other parts of the body as well. The bacteria can multiply and attack the lungs. Tuberculosis, also known as TB, can travel through the air into our windpipe and enter our lungs. When tuberculosis enters the lungs, our immune system detects the bacteria and sends an army of macrophages to the infected area and eat up the bad bacteria. In most cases, this immune response is more than enough to deal with tuberculosis bacteria, but not everyone can be fortunate enough. People with weak immunity due to an underlying medical condition such as HIV, diabetes, malnutrition, etc., find it hard to fight the tuberculosis bacteria. When that happens, the bacteria takes over the macrophages and begin to reproduce and multiply inside it. As soon as they begin to form colonies in the surrounding lung tissue, infecting them and eventually destroying the lungs. It is very important to know that tuberculosis is contagious. If an infected person who is untreated sneezes or coughs, it sends droplets with the bacteria into the air. Inhaling the affected droplets is the usual way tuberculosis can spread from one person to another. But not everyone who inhales infected droplets will get sick or show symptoms. And that is the reason that tuberculosis is divided into two categories.
First of the two categories is the latent TB infection. This is when people have the TB bacteria in their bodies and they don't feel sick or have symptoms. Fortunately, they also cannot pass the TB bacteria to others. The disease may not become active until months or years later at a time where the immune system is weak. Next comes the TB disease. This is when people with Mycobacterium tuberculosis bacteria become sick and have symptoms. This group can spread TB to others. Sometimes it can happen if a latent TB infection was not treated. Some of the signs and symptoms of having the active TB disease are coughing, fatigue, chest pain, weight loss, loss of appetite, and night sweats. The inhaled Mycobacterium tuberculosis bacteria pass the mouth and nose and travel to the lungs, to the terminal bronchi and alveoli of the lung, which the bacterium can then lodge itself into the lobes of the lungs, which can get worse in multiple lobes, especially in those with weakened immune systems. While traveling, the bacterium can get stuck in the tracheobronchial tree, which makes it easier to travel to the lymphatic system and the blood than to the rest of the body. Lungs are the primary place TB affects. 80 to 85% of all cases are in the lungs, but 15 to 20% can affect other places in the body, like the kidneys, spine, brain, lymph nodes, eyes, extremities, and the heart. There are two different kinds of tests a doctor can perform: the Manitoux tuberculin skin test or the interferon gamma release ray, which is a blood test. The Manitoux tuberculin skin test is when a healthcare provider will inject a small amount of substance called purified protein derivative under the skin of the forearm. After about 2 or 3 days, you must go back to that provider so they can check to see the injection site and if there is any reaction. A reaction that's positive means the provider will recommend the interferon gamma release ray. This is when a healthcare provider will draw a sample of blood and send it to a lab. The lab will test the blood to see if there are any pathogens present in the blood. To rule out anything else, a doctor might then perform a chest x-ray, a CT scan, or more lab tests for lung fluid or sputum.
Treatment for tuberculosis. There are different types of treatment depending if you have a latent or active tuberculosis disease. For a latent infection, you might need to only take 1 or 2 types of drugs. Active diseases, however, require taking several drugs. These are types of medications you will need to take during your treatment. The side effects can be upset stomach, vomiting, loss of appetite, severe diarrhea, light-colored stool, vision changes, dark urine, yellow skin or eye color, dizziness or trouble with balance, tingling of the hands and feet, bruising and bleeding, weight loss, tiredness, sadness and depression, rash, and joint pain. What is the prognosis of TB? People ill with tuberculosis can infect from 10 to 15 other people with close contact over the course of 1 year. Without proper treatment, up to 2/3 of the people will die. Since 2000, 53 million people's lives have been saved through effective diagnosis and treatment.
Follow-up for TB. TB disease is curable. It's treated by 6-month standard course of 4 antibiotics. In some cases, the TB bacteria does not respond to the standard drugs or can become drug resistant if a complete dose is not taken as directed. All cured patients are at risk for relapse of TB. Scheduled visits for the patients are 3, 6, and 12 months post-treatment is suggested at minimum. Also, instruct the patient to return to the clinic if there is a cough for more than 2 weeks or persistent fever in weight loss or for any medical concerns. These are some of the different modalities used to diagnose TB. Most common is the X-ray. On this side, you can see a normal chest X-ray. And in the other side, you can see a tuberculosis X-ray image. Our next modality is PET-CT images. The first image shows a patient with a diagnosis with sputum culture positive pulmonary TB. The second image shows a nodal extrapulmonary TB and unexpected pulmonary TB, and it has a whole body projection of widespread TB. And the third image, it shows a CT scan of a 37-year-old male with active pulmonary TB.
MRI is another modality that is used to see tuberculosis. This image is an MRI of a 12-year-old girl, and it shows that the tuberculosis infiltrates are often multifocal and look similar to bronchopneumonia. This is an image of a nuclear medicine scan that is a patient that is positive with pulmonary TB. There are anterior and posterior images that show an increase in pathological tracer uptake in the upper lobes of the right lung.
Thank you everybody for watching this interesting video, and it was presented by Alma, Isabella, Yvette, and Jada. And if you need the references, here they are.